The plight of micro business owners, those with 10 or less employees, is becoming more challenging as our economy continues to decline. The pool of money these entrepreneurs have to draw upon for both business and family expenses has been dwindling, forcing many self-employed to make tough choices. Most distressing, many of the self-employed are scaling back their health coverage, and some are dropping coverage completely in order to keep the doors of their business open. As discussions on health reform progress, the National Association for the Self-Employed would like to emphasize that proposals must address two key issues: affordability and choice. Those two issues being key in order to improve the ability of micro business owners to obtain quality health coverage. The common denominator for all small businesses is that they must pay taxes. Thus, the tax code is an excellent vehicle to provide financial relief to micro business. A key step forward in addressing the affordability issue faced by the 21 million self-employed would be to tackle the current inequalities in the tax code that this segment of the business population faces as they purchase health coverage. And several of those things have been mentioned. I believe Mr. Graves mentioned in his remarks. And all business entities except sole proprietors receive a business deduction for health insurance premiums. Employees and owners pay for their health insurance premiums pre-tax, and therefore they are not subject to FICA taxes. However, a sole proprietor's premiums are not paid with pre-tax dollars, and they're exposed to the 15.3% self-employment tax. The most recent Kaiser Family Foundation study indicated that the self-employed pay on average $12,000 a year annually for family health coverage. Because they cannot deduct these premiums as an ordinary business expense, that would require them to pay an additional $1,800 in taxes that no other business pays. Removing this inequity would be a significant economic stimulus for the self-employed and just a fair leveling of the playing field. Discrimination against the self-employed also persists in health reimbursement arrangements, HRAs. HRAs, distinguishing from HSAs, HRAs are a flexible benefit option that allows small business owners to reimburse employees for out-of-pocket medical expenses, including health insurance premiums. An HRA gives an owner of a business predictability when it comes to benefit costs, since the owner determines the maximum amount of annual reimbursement each employee will receive. It has to be the same across the board for the owner's employees. The reimbursements are tax deductible for the business and tax-free for the employees. An important component of HRAs is the non-discriminatory rules that apply to them. If an HRA is set up, the benefits must apply equally to all employees. At present, self-employed persons are not eligible to participate in an HRA. Expansion of HRAs to allow the self-employed business owner to participate in the plan would likely significantly increase the number of businesses that use HRAs. And HRA reimbursements would likely be more generous if the owner also got to put his or her health coverage in that. So we would like to see that inequity removed. As we look at our health insurance markets, it is important to consider the potential impacts of market reform on micro business. The self-employed and micro business can purchase health insurance in two markets, the small group market, which was referenced, and the individual market. We have seen a definitive shift of micro businesses from the small group market to the individual market in the past 3 years. Thus, for health reform to be beneficial to the micro business sector, proposals must tackle cost issues in the individual market. The creation of pooling mechanisms can be utilized to begin addressing the high costs and lack of negotiating power faced by the self-employed. In current reform proposals, discussion has centered on creating a national pool managed by the federal government to allow small business and individuals to purchase coverage. Micro business owners are evenly split in their opinion on whether a government-run health option is the right approach. Chief concerns expressed are the quality of their health care. Would it be as good or not? Would they have as many choices? And there also is a worry among micro businesses that taxes would significantly increase. The establishment of mandates, either for individuals or employers, has been a hot topic. The NASC does not support the mandating of health coverage at this time. In particular, an employer mandate to purchase and provide health coverage that does not exempt micro business, 10 employees or less, would put millions of owners out of business and would leave millions of workers unemployed. The NASC believes that an individual mandate would be harmful in this current climate. This is not the time to do more harm to business. As you look to reform the system, don't forget that the needs of the 10 or less micro business may be very different than the 200 employee small business. Thank you.